Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, I would like to say thank you for watching my video presentation. Let me to introduce myself. My name is Meiliza Rahmanda, you can call me Meiliza. I'm a student from the JMB Health Polytechnic with the student number P071201200012. Okay, here's the title of my presentation. Face Dangers of Smoking. The purpose of the presentation to explain danger smoking for health. Okay, ladies and gentlemen, my presentation consists of the following parts. First, I will explain to you how about a brief history of cigarette. Then I will explain smoker type, content of cigarette, the dangers of smoking. Finally, you will know how to stop and stopping benefits smoking. So let's just go to the first discussion. A brief history. Reported by the Tobacco Atlas page in its history, smoking was first carried out in South America in 14,000 years BC. At the time, smoking or chewing tobacco was part of the shamanic ritual. Several centuries later, tobacco was introduced to mainland Europe after Christopher Columbus discovered the tobacco plant. The Europeans then brought tobacco to various places using ships. The sailors then imitated the custom of the Aborigines who used tobacco for smoking by compressing it into pipes or cigars. Tobacco, which is famous for its fragrant aroma, turned out to be enjoyed not only by smoking it, but also by inhaling it. This second method is considered more environmentally friendly because it does not produce cigarette smoke. Inhaling tobacco is believed to cure colds and treat inflammation of the nose. This method is widely used in nations in Asia, Africa, America, and parts of Europe. Okay, please look at the picture. Can you see the picture? What do you see in the picture? Yes. The picture on the right is an active smoker, and the picture on the left is a passive smoker. An active smoker is someone who deliberately smokes hand-rolled or rolled tobacco wrapped usually in paper. They also directly inhale the cigarette smoke they exhale from their mouth. The following physical characteristics of a smoker: yellow teeth from nicotine, nails dirty from nicotine, and sore eyes. If these three conditions are unchecked over time, damage to other organs all of the body will occur. Next, passive smoker. Passive smokers are a person or group of people who inhale other people's cigarette smoke. It has been proven that passive smokers experience the same risk of health problems as active smokers, namely people who inhale their own cigarette smoke. The following early symptoms of passive smoking are runny nose, hoarse throat, dizziness, or headache. Okay, next, content of cigarette. The first is nicotine. Nicotine is a substance that causes addiction with a high tolerance. That is, the longer this is consumed, the more it increases. Addiction symptoms also occur in someone who starts to quit smoking. Indeed, at first nicotine can stimulate the brain, so that the smoker becomes smart. However, if this happens continuously, it will actually weaken the intelligence of the brain itself. This is caused by nicotine, which stimulates the production of the hormone adrenaline. The second is carbon monoxide. This dangerous gas should only exist in vehicle exhaust fumes. However, with donations from smokers, this gas, which can bind strongly to blood hemoglobin, becomes more abundant in the air and in the human body. In the presence of carbon monoxide, which binds to hemoglobin in the blood, the heart of a smoker who requires more oxygen actually gets less oxygen. The third is tar. Tar is usually used to pave highways. If it enters the body through smoking cigarette, it will gradually and surely cause cancer. Some examples are benzoylpyrene, nitrosamine, benaptylamine, and nickel. Next, DDT. DDT or dichlorodipenyl trichloroethane. is an insect poison, which is usually used to kill mosquitoes, ants, or cockroach. Next is acetone. Acetone is a substance used to strip paint. You can imagine the danger if the substance is in our body. Next, formaldehyde. Formaldehyde, known as formalin, is used to preserve corpses. The next is cadmium. Cadmium is a chemical that is usually found in batteries or motor vehicle batteries. The next is arsenic. Like DDT, arsenic is a chemical that is often used to eradicate musician insects. Usually, fleas or insects of its class will work if eradicated with this arsenic. The last is ammonia. Ammonia is an active ingredient found in floor cleaners. Wow, how danger content of cigarette, isn't it? Next, danger of smoking. Smoking is an activity that has a negative impact not only on oneself but also on other people or families around them, both in the short and long term. Please note that in cigarette contain more than 14,000 types of chemicals that are harmful to the body, both for active smokers and passive smokers, can cause various diseases and can even cause death. The following disease caused by smoking. The first is cataract. Smoking is believed to worsen eye conditions, namely the whitening of eye lens which block light from entering and causes blindness, more occur in smokers. The second is wrinkled skin. Smoking can cause premature aging of the skin due to damage to proteins that are useful for maintaining skin elasticity. The erosion of vitamin A, obstruction of blood flow, smoker's skin becomes dry and wrinkled, especially around the lips and eyes. Next, hearing loss. Hearing loss. Because tobacco can cause deposits to form on the walls of blood vessels, terribly inhibiting the rate of blood flow into the inner ear. Smokers can lose hearing earlier than non-smokers or more easily lose hearing due to ear infection or loud noises. The next is lung damage. Apart from lung and heart cancer, smoking can also cause choking due to damage to the air sac in the lungs, which reduces lung capacity and oxygen to release oxygen. If this situation continues, there will be a buildup of mucus, resulting in painful and difficulty breathing. The next is osteoporosis. Carbon monoxide, which is a toxic chemical that is abundant in car, it causes and secretes smoke, binds more easily to the blood than the oxygen. So that the blood's ability to carry oxygen decreases by 15% in smokers. As a result, the bones in smokers lose their density, becomes more easily broken or fractured, and healing takes longer. The next is peptic ulcer. Tobacco consumption reduces insect resistance to bacteria that cause so much ulcers and also minimize the ability of the stomach to neutralize stomach acid after eating, so that the remaining acid will eat away at the stomach wall. Stomach ulcer suffered by smokers are more difficult to treat and cure. So, what we can do to stop smoking? From two methods. Method 1, stop immediately. Today you smoke, tomorrow you quit altogether. For most people, this method works best. Method 2, reduce gradually. The number of cigarettes smoked daily is reduced by the same amount until zero cigarette on a set day. For example, the first day you quit smoking, spend 10 cigarettes. The second or third, it drops to 8 cigarettes and so on. Then, what are the benefits quitting smoking? Of course, it's so many. One of them is, within the first 20 minutes, a person's blood pressure, heart rate, and peripheral blood flow will improve. The second is, for the next 12 hours, almost all of the nicotine in the body has been metabolized and the level of CO in the blood returns to normal. Up to 48 hours, nicotine begins to be eliminated from the body. Not only that, the function of taste and smell began to improve, and the cardiovascular system improved. Within 5 days, of quitting smoking, most of the nicotine metabolites in the body are gone. In addition, the function of taste and smell is much better, and the cardiovascular system also continues to experience good improvement. The next is in the following 2 to 6 weeks, the risk of one infection after surgery is significantly reduced. The function of the airway cilia and breath function will also improve, and shortness of breath and coughing will decrease. Within 1 year after quitting smoking, the risk of coronary heart disease decreases by half compared to people who continue to smoke. After 5 years of quitting smoking, the risk of stroke decreases to the same level as a person who has never smoked. Within 10 years of quitting smoking, all-cause mortality and the risk of coronary heart disease decreases to the same level as people who have never smoked. Wow, very interesting, is not it? So quitting smoking is the same as changing your lifestyle to be healthier. So my message is for you, smokers who watch this video. I hope you're aware, and if you really yourself and other people closest to you, please stop smoking. Okay, ladies and gentlemen, this is my presentation video. I hope this is useful. Sorry if there are any wrong words. I'm Meiliza Rahmanda. Stay healthy. Wassalamualaikum warahmatullahi wabarakatuh.